Welcome to my review channel. Let's answer questions in OB. 1. You advised Ella to observe and record the signs of ovulation. Which of these following signs will she likely note down? 1. A 1 degree Fahrenheit rise in basal body temperature. 2. Cervical mucus becomes copious and clear. 3. 1 pound increase in weight. 4. Mittelschmerz. A. 1, 2, 4. B. 1, 2, 3. C. 2, 3, 4. D. 1, 3. The correct answer is A. 1, 2, 4. Choices B, C, D are incorrect because weight gain is not considered as a sign of ovulation. 2. You instruct Ella to keep record of her basal temperature every day. Which of the following instructions is incorrect? A. If coitus has occurred, this should be reflected in the client's record. B. It is best to have coitus on the evening following a drop in BBT to become pregnant. C. Temperature should be taken immediately after waking and before getting out of bed. D. BBT is lowest during the secretory phase. The correct answer is D. BBT is lowest during the secretory phase as BBT is high during the secretory phase. 3. She reports an increase in BBT on December 16. Which hormone brings about this change in her BBT? A. Estrogen. B. Progesterone. C. Gonadotropin. D. Follicle-stimulating hormone. The correct answer is B. Progesterone and is also considered as the hormone of pregnancy. Estrogen is considered as the hormone of women and is responsible for the development of female secondary sex characteristics. 4. Ella remarks her LMP is April 20th. Which day in April did her ovulation probably takes place? A. 6th. B. 16th. Circa 14th. D. 4th. The correct answer is A. 6th. Ovulation happens 14 days before the next menstruation. April 20th minus 14 days is April 6th. 5. Ella states that she gets her menstrual period every 18 days. She states that her flow is very heavy and lasts 6 days. The nurse identifies this pattern as A. Dysmenorrhea. B. Dyspareunia. C. Menorrhagia. D. Metrorrhagia. The correct answer is circa menorrhagia. Menorrhagia refers to abnormally heavy or prolonged menstrual bleeding. A. Dysmenorrhea refers to painful menstrual periods. B. Dyspareunia refers to pain or discomfort during sexual intercourse. D. Metrorrhagia refers to irregular bleeding or spotting between menstrual periods. 6. Ella tells you that she is confused about the role of estrogen and progesterone. Which of the following is the function of estrogen hormone? A. Inhibits uterine contractility. B. Elevates body temperature during ovulation. C. Promotes female secondary sex characteristics. D. Promotes lactation. The correct answer is circa promote female secondary sex characteristics. A. Inhibits uterine contractility and B. Elevates body temperature during ovulation are the roles of progesterone. D. Promotes lactation as the role of prolactin. Situation. Nurse Josh is a family planning and infertility nurse specialist and currently attends to family planning clients and infertile couples. The following conditions pertain to meeting the nursing needs of this particular population group. 7. Suppose that Nene, 14 years old, tells you she wants to use fertility awareness method of contraception. How will she determine her fertile days? A. She will notice that she feels hot as if she has an elevated temperature. B. She should assess whether her cervical mucus is thin, copious, clear and watery. C. She should monitor her emotions for sudden anger or crying. D. She should assess whether her breasts feel sensitive to cool air. The correct answer is B. She should assess whether her cervical mucus is thin, copious, clear and watery. A. Can be fever. 8. Kathy asks about subcutaneous implants and she asks how long the implants will be effective. Your best answer is A. 1 month. B. 12 months. C. 5 years. D. 10 years. The correct answer is circa 5 years. 9. Jinky, 37 years old, asks you how a tubal ligation prevents pregnancy. Which would be the best answer? A. Prostaglandins released from the cut fallopian tubes can kill sperm. B. Sperm cannot enter the uterus because the cervical entrance is blocked. C. Sperm can no longer reach the ova, because the fallopian tubes are blocked. D. The ovary no longer releases ova as there is nowhere for them to go. The correct answer is circa. Sperm can no longer reach the ova, because the fallopian tubes are blocked. Tubal ligation is a surgical procedure that involves blocking, sealing, or cutting the fallopian tubes to prevent pregnancy. 10. Jordan tells you that he is considering vasectomy after the birth of their new child. Vasectomy involves the incision of which organ? A. The testes. B. The vas deferens. C. The epididymis. D. The scrotum. The correct answer is D. The scrotum, because what is being asked is the incision site. 11. The couples are undergoing testing for infertility. Infertility is said to exist when A. The woman has no uterus. B. A woman has no children. C. A couple has been trying to conceive for 1 year. D. A couple has wanted a child for 6 months. The correct answer is circa a couple has been trying to conceive for 1 year. 12. Another client named Linda is diagnosed as having endometriosis. This condition interferes with fertility because A. Endometrial implants can block the fallopian tubes. B. The uterine cervix becomes inflamed and swollen. C. The ovaries stop producing adequate estrogen. D. Pressure on the pituitary leads to decreased FSH levels. The correct answer is A. Endometrial implants can block the fallopian tubes. Endometriosis is an abnormal proliferation of the endometrium. 13. Linda is scheduled to have a hysterosalpingogram. Which of the following instructions would you give her regarding this procedure? A. She will not be able to conceive for 3 months after the procedure. B. The sonogram of the uterus will reveal any tumors present. C. Many women experience mild bleeding as an after effect. D. She may feel some cramping when the dye is inserted. The correct answer is D. She may feel some cramping when the dye is inserted. 14. When reviewing the guidelines for diaphragm use, the nurse knows the client has a good understanding of this contraceptive device when she tells her partner that this device A. Is good for 5 years. B. Has to be used with a condom. C. Must be left in place for at least 6 hours after intercourse. D. Has to be removed between each sexual intercourse encounter. The correct answer is circa must be left in place for at least 6 hours after intercourse. Situation. Educating the women of reproductive age about pregnancy is an important responsibility of a nurse. 15. A pregnant woman is curious about certain things related to her pregnancy. She asked the nurse, in which portion of the fallopian tube does fertilization normally occurs? A. Ampulla. B. Interstitial segment. C. Isthmus. D. Infundibulum. The correct answer is A. Ampulla. 16. Ella suspects she is pregnant. Her urine is positive for human chorionic gonadotropin. Which structure produces HCG? A. Pituitary gland. B. Trophoblastic cells of the embryo. C. Uterine deciduas. D. Ovarian follicles. The correct answer is B. Trophoblastic cells of the embryo. 17. Kathy, 22 years old, has missed 2 of her regular menstrual periods. Her doctor confirms an early intrauterine pregnancy. This is her first pregnancy. To determine her expected due date, which of the following assessments is most important? A. Date of first menstrual period. B. Date of last intercourse. C. Date of last normal menstrual period. D. Age at menarche. The correct answer is circa. Date of last normal menstrual period or the LMP. 18. A 26-year-old woman has missed her menstrual period. The client's last menstrual period began May 8 and ended May 12. The nurse determines that her EDC, estimated date of confinement, is A. February 1st, B. February 15th, C. February 19th, D. March 14th. The correct answer is B. February 15th. LMP is May 8 or 5/8. Minus 3 months, plus 7 days equals 2/15 or February 15th. 19. The nurse learns that the woman's LMP was March 17th. How many weeks is her AOG on her initial visit, which is on June 10th? A. 11 to 12, B. 12 to 13, C. 13 to 14, D. 10 to 11. The correct answer is B. 12 to 13. 20. A 24-year-old woman comes to the clinic because she thinks she is pregnant. Which of the following is a probable sign of pregnancy that the nurse would expect this client to have? A. Fetal heart tones. B. Nausea and vomiting. C. Amenorrhea. D. Chadwick's sign. The correct answer is D. Chadwick's sign, or the bluish discoloration of the vagina. FHT is a positive sign. Nausea and vomiting and amenorrhea are presumptive signs of pregnancy. 21. Which of the following urinary symptoms does the pregnant woman most frequently experience during the first trimester? A. Dysuria. B. Frequency. C. Incontinence. D. Burning. The correct answer is B. Frequency. Dysuria, incontinence, and burning may indicate urinary problems. 22. On which of the following areas would the nurse expect to observe cloasma? A. Breast, areola, and nipples. B. Chest, neck, arms, and legs. C. Abdomen, breast, and thighs. D. Cheeks, forehead, and nose. The correct answer is D. Cheeks, forehead, and nose. Cloasma is the mask of pregnancy. 23. The nurse observes that Vicky's abdomen has irregular scar lines as a result of stretching of the skin due to pregnancy. This refers to A. Linea nigra. B. Cloasma. C. Striae gravidarum. D. Melasma. The correct answer is circa. Striae gravidarum are stretch marks. Linea nigra is a brown line. 24. Which of the following fundal heights indicates less than 12 weeks gestation when the date of the LMP is unknown? A. Uterus in the pelvis. B. Uterus at the xiphoid. C. Uterus in the abdomen. D. Uterus at the umbilicus. The correct answer is A. Uterus in the pelvis. The fundus is at the level of the xiphoid at 36 weeks and at the level of the umbilicus at 20 to 22 weeks AOG. 25. At 22 weeks AOG, the nurse will palpate the fundus. A. At the xiphoid process. B. At the umbilicus. C. At the symphysis pubis. D. Not palpable. The correct answer is B. At the umbilicus. The fundus is at the level of the xiphoid at 36 weeks, at the level of the umbilicus at 20 to 22 weeks, and at the symphysis pubis at 12 weeks AOG. Situation. Health promotion during pregnancy is needed to reduce maternal mortality rate. 26. What is the most important information for the nurse to discuss with the pregnant woman during her first prenatal visit? A. Components of a balanced diet with increased intake of meat and poultry as well as whole grain products. B. The importance of attending the childbirth programs and understanding the growth of the fetus and normal changes during the pregnancy. C. It is important for the client to understand measures to decrease risk associated with pregnancy. D. It is very important for her to report problems with swelling of hands and face, as well as increased vaginal discharge. The correct answer is the importance of attending the childbirth programs and understanding the growth of the fetus and normal changes during the pregnancy. 27. A married 25-year-old housewife is 6 weeks pregnant and is being seen for her first prenatal visit. In relation to normal maternal acceptance of pregnancy, the nurse would expect that the client feels A. Some ambivalence now that the pregnancy is confirmed. B. Overwhelmed by the thought of future changes. C. Much happiness and enjoyment in the event. D. Detached from the event until physical changes occur. The correct answer is A. Some ambivalence now that the pregnancy is confirmed. 28. How often her prenatal visit will be at 7 months age of gestation? A. Every week. B. Twice a month. C. Once a month. D. It is not necessary. The correct answer is circa once a month. In 1 to 7 months, prenatal visit is once a month. On the 8th month it's every 2 weeks, and on the 9th month it's every week. 29. Women who drink alcohol during pregnancy. A. Often produce more alcohol dehydrogenase. B. Usually become intoxicated faster than before. C. Can give birth to an infant with fetal alcohol syndrome disorder. D. Gain fewer pounds throughout the gestation. The correct answer is circa. Can give birth to an infant with fetal alcohol syndrome disorder. 30. How can a primigravida client most readily meet her increased daily iron requirements? A. Consuming at least 4 glasses of milk daily. B. Adding an extra source of red meat to her daily diet. C. Taking an iron supplement with a vitamin C source. D. Including an extra source of fruits or vegetables. The correct answer is circa. Taking an iron supplement with a vitamin C source.